Good evening, ladies and gentlemen. Welcome to the national headquarters of the Theosophical Society in America. My name is John Chianchosi. I'm the Director of Public Programs. And at this time, I would like to ask that you turn off your cell phones and other noise-making electronic devices. Thank you. This evening's presentation is being streamed live through the internet, and so I welcome friends watching from home, all over the nation. The Theosophical Society promotes study, meditation, and service. We encourage open-minded inquiry into the world religions, philosophy, science, and the arts. And we have a deep respect for the unity of all life. Our goal is to help people explore the spiritual path so as to arrive at a deeper understanding regarding the wisdom of the ages. Furthermore, we feel that this wisdom is not limited to any one tradition. Therefore, we offer programs from all traditions. I invite you to take one of our program brochures that lists the programs that we are offering during the remaining month of February and March. A new program brochure will be coming out in a couple of weeks that will have the programs for spring and summer. So that's something to look forward to. Of course, you can find all this information when you visit our website. On our homepage, you'll see on the top programs, scroll down, and you'll find a full listing of the programs listed under different categories, beginning with the Thursday lecture series. And of course, on the website, you can also register for many of these programs, especially the workshops and retreats that are usually held over the weekend. On the website, you will also find, especially for those not living in this geographical area, maybe watching through the internet, that we are currently offering many programs in the webinar format or online. People can participate in these programs from wherever they are, provided that they have a good internet service. And these programs are very, very interesting. They are interactive, and we have some world-class teachers presenting classes, 4 or 5 week classes on a variety of subjects. I encourage you to look at those. Even those who live close by, you may want to participate in some of those classes. And of course, we have ongoing groups that meet both physically here at the center throughout the week and also online in our online education programs. Now, the Theosophical Society is a membership organization, and as such, we're always happy to welcome new members. Please consider joining if you are in agreement with the mission of the organization, as it is the best way to support our work. And of course, if you are a member, please renew regularly, once a year. However, what we offer here is open to the public at large. Everyone is always welcome to come to any of our programs and to make use of the wonderful resources that we have here, including our library, our bookshop, and our wonderful grounds, which are even more wonderful once we have spring and summer. So, this evening, I am especially pleased to have our guest speaker who's, she has spoken here before, but it was before my time as programs director. And so this is my first opportunity to introduce her. Dr. Marilyn Mitchell may be known to some of you. She has quite an interesting background. She received her medical degree from Rush Medical College and completed her residency at the University of Chicago. She is certified by the American Board of Obstetrics and Gynecology and the American Board of Integrative and Holistic Medicine. Dr. Mitchell is an educator, speaker, and health visionary. She has been a leader in the field of integrative medicine and a passionate advocate for the importance of combining energy healing with traditional medical care. She is also the founder of HealingSpace, an organization that promotes and encourages the integration of alternative modalities with traditional medicine. And tonight we are, as I said, very fortunate to have her here, and she will be speaking on vibrational medicine, energy healing for reversing health disorders. Please join me in welcoming Dr. Marilyn Mitchell.
Thank you. I'm so pleased to be back here at the Theosophical Society, and I'm really pleased that you came tonight. We're going to talk about energy healing for reversing health disorders, but before we start, I just thought I'd like everybody to kind of settle in and do as they do in the Ayurvedic tradition whenever they're starting something. Just relax and open up to something greater. So, just feeling that, and so that the exchange that we have tonight is just as it needs to be. Okay, great. So I'm going to deliver some information, but I'm hoping that you'll also go with me on this journey and be able to take something very personal away from it as well. See if I can make this work. No. Okay. All right, I'm just going to... I felt like I wanted to tell you a little bit about my story. You heard my medical credentials. I have some healing credentials, and I feel like those credentials often were, you know, kind of my justification for the woo-woo stuff that I was doing in the background. But I'll just tell you how I got into it, because I think that might help you know where I'm coming from. So it keeps changing, and I keep traveling. So about 42 years ago, I was thinking about what I wanted to do as far as after college, and I was debating about going to medical school or not, because I kept thinking, you know, I don't think the doctors are really about health. Even back then, I realized that. And so there are only 2 times in my life when I have heard direct verbal guidance where it was so clear that it was a voice. I've had other guidance, but this was one of them. I heard a voice that said, I was debating, and it said, you know you want to go to med school. You want all the knowledge that the doctors have, and you want all the authority, but be assured you'll bring something of yourself to it later. So I'm like, all right. So I went to med school. And I was just kind of this quiet rebel. I thought, you know, teach me everything you have to teach me, but I'm going to think for myself. You know, I was kind of a hippie and a yogi, and I meditated, and I also knew nutrition, and they gave us like half a day of nutrition in those days. And it probably was the 4 food groups or some crazy thing. So that was my first thing. So I kept being curious. And while I was in medical school, I didn't know where I was going to go with it or whatever. And then one of the most amazing experiences happened. I was allowed to deliver a baby. And the energy with that was so incredible. I was like, okay, I have to do this. I have to be in this energy. And it turned out to be exactly the right choice for me to go into women's health, because, you know, women like, you know, they didn't want a lot of medicines. They wanted to be healthy. And so I began to self-teach. You know, I was self-taught in holistic medicine, because something would come up, PMS, or, you know, even menopause. And I was like, well, gosh, they really didn't teach us. How would I want to be treated if this were me? So I would go learn it. And then eventually there were trainings in holistic medicine, but that's what I did. But, oops. What did I do? I got it. So eventually, you know, I did some other things. I was at Cabrini Green for a while. I was the director of integrated health, or OB-GYN integrative health over there, which was really fabulous, and at Northwestern. And then after that, I co-founded Woman Care and was the director of integrative healing there. But for the most part, the most compelling thing that I did in those days and through the years was I found out that when I would close the door with a patient, whatever was going on, I would start to have this intuitive knowing about what they needed. So it didn't matter to me if it was, you know, they would come in for whatever they thought they were coming in with, but a lot of times I would be able to know what held that in place and what was going on. So that was really my real training, ongoing through the years. And that began to build, you know, at first it was kind of like, I'm not asking her that. But every time I followed through and asked what it was that they needed to tell me, it worked out. So I began to trust that guidance. And then there was this night that just really changed everything. So this is the other time that I heard verbal guidance. So I used to get little psychic hits, you know, and I was sleeping in my bed when I was on call at home. And I woke up and looked at the phone on my bedside table, and I thought, oh, they're going to call me pretty soon from the ER for an ectopic pregnancy that I have to go in for. So I dozed off 10 minutes. They called me, and indeed, there was an ectopic in the ER. And I'm like, oh, I love when that happens, when I get those, you know, those little messages. So I started out and was driving to the hospital, and it was a really beautiful starry night. And I was just, you know, feeling really kind of in an altered state, I guess. And that's when I heard, this is not a normal ectopic, in those words. And it was frightened me. So I kind of came to, and right after that, the nurse from the emergency room called me and said, don't come here to the ER, go straight to the operating room because this patient's unstable. So I did. I went straight to the operating room, went in, and I was ready before they were even ready with her. You know, they were getting everything ready for me to operate, and everybody was really scared. And she was pretty unstable, trying to keep her blood pressure stable, all of that. And I was just standing, and I was sort of seeing what it was that we had to do, what I was going to do next. And as soon as they told me I could put my scalpel on the skin, and I went, oh, I know where it is, because I had seen it. I had seen what it was, and what it was when I opened her was her ovary had exploded. So it was an ectopic in the ovary, which I had never seen before, since it's very, very rare. That's why she was so unstable and hemorrhaging. So we could quickly take care of it, and that was great, and everybody relaxed, and she was going to live, and all was well. And I was driving home, and I went, what just happened? I had seen inside the body, and that really changed things for me. I thought, I need to cultivate this. I really need to follow this and see where it leads. So that's when I decided to actually go to healing school. I'd been dabbling and learning some things, so that's when I decided to do that. And after that, it was so wonderful, because anytime I was about to start a surgery and it was not going to be routine, it was going to be unusual, I'd see inside, I'd see it. I'd get a little mental picture of it. So that was great. So then I went and did some healing training. I had done the Marielle healing training. I don't know if any of you have heard of that, Ethel Lombardi. Yes, and so I had learned that one. And, but when I had that experience with the ectopic is when I decided to go to the Barbara Brennan School of Healing. I'm sure many of you have heard of that. That was a wonderful experience. Came back and tried to see how I could fit that into my practice. And I just didn't know how to talk about it really, but I ended up using it mostly in the operating room. And the nurses never asked anything. They just let me do my thing. And, but then I went back to the school after graduation and met another graduate who was doing this very advanced healing. So she was working in not just the 7 levels of the auric field that you know about, or the 7 chakras, but she was working up in the 2nd, 3rd, 4th sets of chakras. And she had had some cancer reversal. She found out that I was a doctor, and she wanted to tell me about that. I'm like, okay, wait, what? I didn't know that you could do that. So anyway, we convinced her to start a school, and I went to her school and finished that, and then became the director of medical integration there, and started teaching healers. So we had workshops for healers who were interested in working in medical settings, doing this really advanced work. And that turned into an internship for healers that I did for working in medical settings. And that was really, really profound and moving. And so all of the healers that I have in my office have done this internship with me as well. So that's kind of how I got there. And so now I founded HealingSpace, and I feel like I've recently understood that I sort of specialize in people who don't follow the rules of medicine. And so we're going to talk about that a little bit, because we've kind of been programmed to think about things a certain way, and we actually have way more than just this mechanistic body. So I'm kind of having a new inspiration, a new calling, to just bring my message to a larger platform. So I'm happy to be here tonight, and I started an online course. I piloted an online course to see if we could do some of this work in the intuitive and shifting things online. It went well. So I'm starting to do some more of that, and I really have, I just have an inner drive to start doing that, to bring the message out. I also am going to be speaking with healers at the Barbara Brennan School, and I have a good relationship with even very conventional doctors. So my feeling is that my audience is also the medical doctors, because they're struggling too. I mean, they're just like we are. Well, I guess I'm one of them too, but not too conventional. Okay, so before we get into, I really want to share with you some of the amazing cases we have of reversing diseases and health disorders with energy, and how we do it with the energy healing. But I just wanted to kind of give you a framework, because a lot of this you can do yourself. And the way that I'm thinking about it these days, I felt that that it would be good for me to kind of give you some of this foundation and how I think about it. So when we're healing, how do we really heal? Any of us, whether we're doing, whether we're actually doing healing on someone else or we're trying to heal ourselves and progress. And what I feel is the essence is that we access our native inner vitality, so that eternal part of us, so that we can shift to a more alive way of being. And I think that's what we're all about. I mean, that's why you come to the Theosophical Society. That's why we search. That's why we study, why we meditate, why we do any of these practices, is because we're really trying to get more. And we feel like there's something more than what we've been taught to think and how we've been marketed to. So I want to just tell you how I believe we're made, and sort of 6 principles. And well, really 5 are the principles of how we're formed and how we operate. And the 6th one is kind of like a soapbox, but you'll see. So every person possesses an indestructible inner vibrancy and life force. So we all know that. This enormous potential can be accessed to recover from symptoms or diseases, and to manifest full, healthy, happy lives, and even actualize our life purpose. So I know that's why we come into this world, is to bring that in. And I know that it's natural for us to live from that full, vibrant life force, and we have an inner drive to do this. We are not meant to live in a reduced form, but so much of our lives we do live in a reduced form. This is key for me. Dialoguing with the habitual thought patterns and programming that limit us does wonders for freeing up this liveliness potential. And when we begin to live from our natural state of vibrancy, we can effortlessly experience an integration of body, mind, and soul. So here's number 6. From this perspective, it is apparent that our social systems of healthcare, business, government need this healing as well. And we do that probably one person at a time. Okay, so when we are doing energy healing, what we're doing is bringing this natural vibrancy to wherever it has been blocked, allowing a shift into a more alive way of being. So that's a general way of putting it, but that is really what we're doing. So I want to talk a little bit about this vibrancy, and if you want, you can just try and feel it with me as we, in this moment, because it's the part of us that's our true presence, it's our higher self, it's all of that. So I like, you know, being an obstetrician, and now I have 2 grandchildren, little grandchildren, so it's like I've gotten to watch this again and again and again. I mean, delivering babies, when they come in, there is something amazing, and in that, during that time of right before birth and birth, it's like the heavens open for real. And I used to get these downloads of information and all during that time. It's a beautiful time. So, but think about whenever you've been around a newborn. I mean, has everybody been around a little newborn? And little children, very little. It's like they are pure presence. They are pure presence. They don't have any other thing. And it's just like they're a light. And when you're with them, you light up too. It's like, oh yeah, that, you know, you just can't help but feel it. That's how we all came in. We all came in that way, and we all still have that. And when I talk about it, you're all smiling. You're all feeling it. But so the idea is to feel that and let it rise up. Even little children. I mean, my 2.5-year-old granddaughter, she's 2.5 now, so she's started to get some, you know, it's hemmed in maybe slightly, but she loves her body. I mean, she just, you know, it's like, remember that? It's like, you know, we don't remember that, but it was just, everything is wonderful. She sat down on my lap one day, and she was completely alert, but 100% relaxed. And I'm like, oh yeah, teach me how to do that again. You know, right, because we're on. Okay, so we start with this. And it has everything we need. I mean, think about it. I have to just say one other thing about this. When, you know, medicine is so science-oriented, like science, 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 which is fine, but science is really just descriptive, and really no scientist in a lab could ever put 2 cells together, join 2 cells, and form an entire human being in all its complexity in 9 months. That then unfolds, like we're saying. It has the programming to do everything it needs to do and to stay healthy and well. Not only that, it has an inner knowing about what, you know, about what it needs. So there's way more at play than just the mechanistic science that we're used to. So what happens? Well, you know, we get born into families, into society, into structures, have to go to school, all of that, and we start to form this mind, you know, this linear mind that and what we're taught is that we have to solve everything from that, we have to live from here, we have to execute everything from here. And it becomes, we have a field of people in our culture, in our world, giving us this idea that we have to do it from here, and that the rest of this is not even spoken of. So the mind is what begins to damp down this inner vibrancy. Okay, so the mind it's really has our survival mechanism. It constantly narrates our life. I know that you're meditators in this room. But you know, it's still, then, which helps. But it's still, you know, there's all these things we have to do. And all of these things that we have to make money, we have to, you know, we have to worry about things. And, you know, when you're done meditating, you can still get wrapped right back up into it. The mind only knows what it has already known. It's not creative. So it knows what it's Googled, it knows what it's been told, it knows, it can only give you the same thing. It can't give you anything new. That comes from that vibrant part. It easily becomes fearful. And we live in a society of fear. Our medicine is fear-based, you know, and so it's constantly saying, look out, look out, look out. The mind is constantly saying, oh, here's what you forgot to do yesterday, again and again and again, even though yesterday's gone. And here's what you have to do today. Here's what we have to do today, again and again and again. It's often a young voice, so some of these things get put into place at a very, very early age. So when you have perspective, listen and see if it isn't a young voice talking to you. It is really not up to that task of running our lives, but it feels that it must. And it forms very strong beliefs. So beliefs, we're programmed to live in our heads, right? That's our programming. We are trained to listen to our fears, not our bodies, not our inner knowing. And the problem with this is that we create our bodies and our life experience from the thought grids of belief. So there's a, energetically, if you go beyond the 7th chakra, the 8th, the 9th, there's a 9th level of the auric field that has our unconscious belief grids in it. And those are, so those are the unconscious ones, and many of them we hold without even ever having known them consciously. So I might be getting ahead of myself, ahead of my slides anyway. So we know that many of these beliefs come from parental teaching and modeling and our life experiences. So something traumatic is going to put in a decision about how you have to be in the world, and what you have to be afraid of, and what you have to be vigilant about. There's cultural and societal beliefs. So, well, I'll get to that in a minute. Authority figures, obviously. Okay, the medical profession. So we have it a certain way. Let's take cancer. This is what happens with cancer. And so maybe you get a diagnosis of cancer, and you never even knew that the medical profession thinks that this kind of cancer is fatal or that or whatever, but it's in there because of the culture. And so you follow suit, not even because you've heard it with your linear mind, but because it's part of our cultural beliefs. So we tap into those as a group because we're energetic beings. Or how about marketing, like from the pharmaceutical industry? A need is created and a product to go with it. And then we're marketed to, so that we expect that everybody's just going to have cholesterol, high cholesterol, hypertension, this and that, and the other thing, and we've got the product for you. I could do a whole thing on that, but because there's a lot of research that they don't report and that kind of thing. But it's because it's a profit goal, and that's part of those unconscious belief grids that we live under. Is that we are, our whole culture is formed on a business model. So obviously, pharmaceutical industry is not a service industry. It's it's an industry that's for profit. The problem is that our bodies are obligated to comply with our beliefs. So our bodies know what to do and can function as long as they have the energy that they need, but they follow whatever it is we believe. And you know this. I mean, you've heard the stories of people who, they're told they're going to die within a year, and they do. Or so we know that that's true. So when we access our deeper vitality and inner knowing, we give ourselves a rich natural resource to create healthier beliefs and bodies. So this is not an easy thing to do, especially to do alone. But we even having the awareness, but bringing our mind around to it is not a simple task. And the way I think about it now is it really takes patience, practice, and it takes kindness toward the mind, because it's been given this job that it can't do and shouldn't have to. So rather than, like a lot of times when we teach meditation, we say, okay, get rid of the monkey mind, right? Which, in the moment that might work, but it really backfires, and it also doesn't give us an opportunity to be whole and integrated. So if we can bring that mind on board, if we can transform it, if we can teach it a new way, then we're in a much better place, because then we do need our minds. And if they were functioning in concert with that deeper vitality and that inner knowing, we would be a lot better off. If we have time, I will give you a little tool for that that's very simple. Okay, so let's talk about energy healing for reversing disease. So I want to share with you some of the things we've done with energy healing. I know you may have questions, but we're going to do questions at the end. So, okay, so I just want to tell you some of the technique. I'm not going to tell you a lot about it. I thought, we can talk a lot about, all the techniques that we learn. When you go to school for 4 + 3, 7 years for energy healing, you learn a lot of techniques. So I'm going to tell you a few of them, but then I'm just going to tell you the essence of it and some examples. So this is some of the things that we do. We work on the DNA level. So not all genes have to manifest. We work on the cell anatomy. We remove abnormal cells energetically. We work with cellular memory. So particularly in trauma, you may solve some past trauma with talk therapy for your head, but the body still holds that, and it's doing you a favor trying to hold it away from you. But there are ways to get that released without reliving it, and so that it really is out of your cell memory. We work. Okay, this is so funny. I don't know how this happened on this slide. I don't know why that is in there, but it's just like reminding us we are programmed to live in our minds, because that's not what the subject of this slide is. So we work on a hologram. So we work on an energetic form of the physical body. So even when we're in the room, we're not touching the body, but you feel as if we are a lot of the time. So the hologram obviously is less dense than the physical body, but it allows us to shift the templates and the programming. So those templates of the unconscious beliefs, or any of the other templates or areas that are holding dysfunction. And it also allows for distance healing, because even if we're in the room, we're really at a distance. But it's interesting because we do distance healing. And I've done it even in Europe. I have a brother who lives in France, and I've done healing over there. But every time you do it, you kind of go, gosh, it actually worked again. Because it just seems so impossible, but it is possible. There's some other techniques. We do clear chakras. We do work in the different levels of the field. We do pull out dysfunctional energy that's in there, and energetic influences, and just kind of whatever it takes. But essentially, this is what I would say we are doing. We expand our field and our senses, so our energy field and our senses, open our heart to our vitality, follow guidance, and open the flow of energy to anywhere it has been blocked. So that's how it feels. And when you do that, over time, you actually learn new techniques. It was interesting when I started doing this advanced energy healing, I would be given some medical things to do because I had that. I was able to do that. So some things would come in medically. It's like, oh, you can just remove this with forceps or some funny thing like that. And so it's nice to work in a group of healers because you share things and learn new things about what you can do, but it's really infinite. And it comes from the most loving space, really. Okay, so I have to tell you, I said that I was a doctor who specializes in people who don't follow the rules of medicine. And through the years, I've had people come to me who healed themselves before they ever met me. The one I remember from the past was someone who'd had breast cancer, and she came in and she said, I just feel like I need a doctor, and I want to tell you my story. And I felt so blessed that she would come to me and trust me. So I thought, this is great. I mean, I don't need to be the one that helps people. And then just about 2 months ago, in the same month, I had 2 people come, one with MS and one with rheumatoid arthritis that had been diagnosed pretty severe. So both of them separately came in, had been diagnosed like 2 years prior. and had gone to the doctor, and they were told what the treatment would be. And they just said no. They just said this inner no to the fear, no to the treatment, and went home and started working on it themselves and healed themselves. And both of them said the same thing to me, which was incredible. They came in and said, I found you and I knew you would believe me. I was like, whoa, how, and you know, I felt just so grateful to be the one to accept them. And so then, and now we're working together too, but they don't, yeah, I mean, they don't really need me except as a validator. And you know, that's one of the other things we do as healers is hold that healing space, hold that possibility for people. So that's part of what I do too. So I'm going to just tell you some of the things we do and some of the cases that we have had. So we work with viruses, reversing herpes, HPV, HIV. I have an interesting story with a woman who had herpes. We were working on that and you know, pulling the virus and trying to get it out of the nerves, and so that she wouldn't have it anymore. And it did not go away until she had this epiphany. She said, I don't think I ever really, she felt that she had gotten it from her husband, who she'd divorced many years before when she was young. And she said, and in the healing, she had this insight. She said, he did not give that to me. I don't even think I really had it. And after that, she said, I think it was like, I think I created it energetically or something like that. Anyway, even her blood went to negative and she never had it again. But that both of us could feel that was the shift that allowed her body to go, I don't have to act this way anymore. HPV, HIV. Haven't worked with anybody in quite some time with HIV, but it's not as much of a thing. But 10, 15 years ago, there were a group of us healers working with that quite a bit, with success. We've worked with cold and flu viruses, and as I was creating this slide, I thought, wow, isn't that funny? Because that's one of those things where, you know, you're in the middle of it and you're about to end it, and you're like, oh, I could have done a healing, you know, or could have gotten a healing. Same with a headache. It's like, oh, I could have done something for that. But that's another thing. We can pull virus and shift that out and raise it out of your field. Okay, I want to tell you about my patient with rheumatoid arthritis. This was some years ago, 56 years old. And she'd had it, but it wasn't really getting to her. And she had serious, serious worsening after being suddenly widowed. They'd put her on methotrexate, even the chemo for that. She had decreased mobility. She came into me just as my gynae patient. She said, look at me, you know, what's going on? I can't move anymore. I can't do yoga. I can't do anything. And I said, let's do some energy healing. So she had 5 sessions, and she was working with another healer, and she came running up to me in the office and said, look at me, I'm moving, everything is great. After she had like 5 months, 5 sessions, and the only thing that was left were the knots on her fingers. And so they kept working, those went away, all her, you know, everything went down. And about some years later, she had a recurrence. And it was when her best friend was widowed suddenly. Isn't that wild? But it just shows you how none of this is random. You know, we are really wired on every level. So, and it always is most valuable when you connect with whatever the meaning was of that disease that you had or that episode that you had. And I think you know this in your emotional life. When you understand, if you have a trauma or something like that, if you understand what the meaning of it was and can own that, then that's when you can have a shift. Okay, this is a sweet case. This was, I met this patient, I was still a student in the advanced healing, and my friend came to me and she said, I heard you do energy healing. She was a pastor and a friend, but I was like, okay, well, yes, am I busted or what? But she asked me to work with her friend, her best friend's daughter, who had a migraine at a level of 8 to 9 out of 10 pain for 8 months. It never went away. She went to the Diamond Headache Clinic. She'd been everywhere. It was so bad that she was blind and deaf on the left side. She could see out of the right. So I did 2 distance healings on her. I said, well, we could, we'll just try it and see, because I'm a student, So did the 2 distance healings, and then she came, because she lived in Southern Illinois. And then she came in for the final healing in person. We just did that one last little piece, and that was it for her. She was, she had complete relief, and even 2.5 years later, she was completely fine. She was able to finally go to college, drive. She graduated in 3 years. She got her life back. So that was for me to learn too, that it isn't about me and being a student or anything. It's like about how much we can open up. I had a patient that had stage 4 ovarian cancer at diagnosis. She was my gynae patient, and she did a series of healings while she was having her workup. So when they went to do her surgery, she had reversed to microscopic. They had expected to take her bowel out, but they didn't have to do that because it wasn't involved anymore. So this was a case where all of us healers who know that the work works had never seen it this dramatic, that quickly, and without any other adjunctive therapy, because most people we work with will do both. But she knew from the very beginning this was not going to be fatal. This was not going to get her. So, so she had a few episodes where she had her CA-125. So she cleared up. She had a little bit of chemo. She did really well and was doing fine. But over the years, she had a couple of times when her CA-125 would elevate. They'd give her a little chemo. It would be better. But it was just about 2 years ago where she came in and we did a healing, and she said, I am done. She had a lot of anxiety, which she had a huge relief of that in the very beginning when she did her healing, but it was kind of like the final thing where she was absolutely living her life and said no. So she's 11 years out, I think it is. We had someone with a stage 4 breast cancer. They offered her Herceptin therapy only because they didn't really feel like they were going to be able to do too much. But she reversed to a stage 1. She's 6 years out. So, we have reversal of pancreatic cancer in 3 cases, and that's 8 years, 6 years, and 5 years now. And they're not going to recur. Oh, 3 years. Endometrial cancer. Okay, so this is a recent case that I had. So this is another one of these, not following the rules. So she was having some weird bleeding, did a biopsy and felt like there were some atypical cells. So she had a DNC that showed a grade 3 tumor. So that's a bummer because, grade 1s for endometrial cancer is like you can really just do the hysterectomy, it's over, you don't have to do anything. It's like, and it's not a very scary thing. Grade 3, they consider stage 4 automatically, and that you're going to need all this adjunctive therapy. So that was kind of crummy. She'd been working on herself for a long time, and she had this huge healing shift. She did work with one of our healers, and it was after that. And so she insisted on having another biopsy, and she had a biopsy that was grade 1. But you really can't count that, and I believe that too, because it may be that only got another part of the, So she's still in the same boat. But she had her surgery, and the final pathology was a grade 1. And she'd moved from hospital down to Northwestern to get, the experts and everything. And they were so shocked that they said, we didn't need to see that original pathology because maybe it was never a grade 3. Never, And we're like, and indeed, they reviewed the slides and it was. So she doesn't require any further treatment, but she is a changed woman. So beautiful. So sometimes these things in our way where our body gets our attention are the doorway, and that's what she feels like. This was my opportunity to really get it. I just want to tell you about nerve injury because this was a patient of mine when I was early doing healing, and she woke one day with transverse myelitis affecting. So she had it's as if she'd had an injury there, affecting her legs, walking, and her bladder. Nothing medical was working for her to do anything different, steroids, whatever they could do. So we just decided. I said, let's give it a go. We'll do the energy healing. So. And she said, well, at least, there's nothing to lose. And this was a time when I was like early, and I just saw the nerve there, and I thought, if it's there, energetically, it's like, why can't we just get it to work? And this was the time when my mind was going, that's impossible, that's impossible. So that's when I learned to say, shh, okay, but come here, let's just watch, let's just try it. But you can be quiet and listen. So we did that, and she got up from the table, and she put her feet down on the floor, and she said, "This is the first time I've felt my feet in ages," and and all of that began to reverse. Okay, so how's our time? We've got a little more time. Do you want to hear one more case? Okay, so. This is a beautiful case. I had a patient who came to me again when I was in the advanced school, but I was a student. And she had a whole history of fatal breast cancer. So everybody, all these women in her family had died. And she was coming to me, and she said, and now I've got it. A brand new patient to me. I'm like, ee. So she said, I think I want to do something different. I really want to do alternative and something different. I think I really want to do the healing. I know that you do the healing. And I said, well, why don't you go to my teacher? Because I was kind of scared to do that. So I did. So she thought about it, and she went away, and I talked to my teacher, and she said, you can do this. Okay. So I did. So I did undertake that, and she agreed to do all the medical stuff too. So I'm like, shoo, okay, I think we're good. So we did a series of healings, and she was one of my best teachers ever. I mean, she did everything about it was something that I remember to this day, and we were just meant to meet. I met her before she'd start any therapy or anything, and one time we were in the healing. It was the day before she was going to have her first chemo. So I'm like obsessing, really. I was like putting this filter in for the chemo so that only the good stuff, it would only go to the good places and not harm the bad. And I kept doing it, and I'm thinking, okay, I don't know if I did a good job or not. Maybe tomorrow, like right at the time, I'll just set my phone, and then I can, reinforce it. And I'm like, here I am in a sort of expanded state, really worrying about it. And all of a sudden this calm came over me. And I saw this figure there. I heard, I will be there. And and I thought, oh, there's the chemotherapy angel right there. And she felt him every time she went in to get her chemo. She could feel this presence there that was guarding her and guarding the chemo. And she said, all the nurses really love it when I come in. They're always like gravitating to me. And I'm like, well, of course, because you're doing an energy healing while you're doing this. She had, she would have, when she'd have the chemo, like 3 days later, she'd always get constipated. So we finally just put her, it's like she could just call, put herself on the schedule. We put her in a side room. I'd go in, just run energy, and then she could go on her way. So that was something I learned that was new. I also got this information that this was going to be a teaching for her, but not just for her, but something in her at her work, the people at her work, and other people beyond. So that was pretty amazing. When I was up in those grids I was telling you about in the 9th level and working on those, I came to something, and it seemed kind of tangled up. It was like tangled up. So I thought, I think this needs to be untangled. And what I sensed was, this was where the grid of being part of the tribe, part of the family, part of the ancestry had gotten mixed up in having the disease. I'm just getting shivers talking about that. Because I was like, ooh, we know this. We know that happens unconsciously. I mean, you would never consciously choose that. So I untangled those so that she was no longer obligated to, in order to be loyal to the family, to take on the disease. So we know that happens because not all genes manifest. None of that is written in stone. So that was a huge teaching to me as well. So I'm glad you wanted me to give you tell you another case, because that was pretty profound. That was what I wanted to share with you. We're going to do, I promised you, we do have a little time. So I'll give you a little technique, and I'm going to do some of this on Saturday. I'm doing a workshop here on Saturday, and we'll do some things like this, some things so you can do the DIY at home. But a very simple thing you can do if you're having mind chatter, if your mind is racing, all you have to do to disarm that is to relax your tongue. It's like flipping a switch. So if you want, you could just try it right now. And you don't do anything with your tongue, you just let it release. And what you're going to feel, so just play with it, be relaxed. And what you want to do is, it helps to soften your eyes, because our minds kind of tend to be on with the eyes focused, but you soften or relax them. So what you'll notice is, as soon as that tongue lets go, the voice can't speak. The reason, isn't it cool? The reason for that is that whenever our minds get going, that stream of consciousness, they're getting ready to speak it out loud. And they can't speak with the tongue relaxed. So when that happens, you'll notice that you're instantly present, in that present vitality. And you'll start to notice other things releasing, other little holdouts, so jaw, it might be, or neck, or shoulders, because we have this wiring that when that mind gets going, we're up and out, and so all of that naturally lets go. So that's kind of a cool thing. You can do that before you meditate. You can do that anytime you go, okay, wait, shh, I don't need any of this. I'm getting stressed out, But the other thing I added to it, so I learned that a few years ago, and then as I started working with patients on it, I was like, we need something else. So what I added was to actually engage the mind. So we usually are like saying, go away, mind, But what we really want is for it to sort of help it transform. So you ask it to, so you say, okay, I need your help. So don't go away. Stay here, but I need you not to talk. And here's what I do want you to do. And then so you need to know what you want it to do instead. So it can be quiet and alert and observant. But like that time in the energy healing when I was hearing, you can't, it's impossible. I said, okay, but just let's look. I'm going to ask you to just look and let's try it. So that's the kind of way you want to position it, so that part starts to feel, it's like it's safe. So you can say something like, okay, I'm going to ask you to not talk, but I really want you here with me. So you can listen to this deeper part and remind me about it when I need it. Or if you're having trouble falling asleep, or you're waking up later, before you go to sleep, you can kind of pre-program it. Ask your mind to be in charge of that, giving you a good night's sleep. Because it's usually the one that's waking you up, right? So if you start out by unwinding and then saying to your mind, okay, come on over, I need your help. I really need a good night's sleep, so I'm going to ask you not to talk. But I really want you to guard my sleep and tell me about my dreams in the morning. And I've had a number of patients try that, and if you're one that wakes up in the night, you fall asleep okay, still pre-program ahead of time, and when you wake up that first time, you just remind it, okay, before it starts going, oh my gosh, I need a good night's sleep, we're awake, and really wakes you up. And after a night or two, you'll sleep. So that's my little That's my little take home for you. And if you want to do more, so I have this too. So I'm doing that workshop on Saturday. We'll do some of these things. If you want to join my email list, you can do that. And I'm going to start a community call. It's just a free call. Give information and question and answer online. So if you're interested in something like that. I piloted an online course. I'm going to do a full one. So there's that. And we have our office in St. Charles as well. So I do have an email sign up. But let's take some questions. Oh, that's my mic. Sorry.
Thank you so much, Doctor. Yes, we have plenty of time for questions. Just raise your hand and I'll bring you the microphone so that we can record the question as well as the answer.
I was just curious to know, because I'm very new to energy healing, what are some of the techniques that you're talking about? I mean,
Well, I'll tell you, so when we do a session, an energy session, where you're on a massage table, kind of fully clothed. We're not touching the body, but what will happen for you is this kind of what you wanted to know. What will happen for you is you'll be lying there, and most people kind of doze off or go into an altered state or rest, and you may come in and out of consciousness, but you tend to it may be just subtle, but a lot of times you'll feel the energy moving. And what we're doing is we have some routines that we do, like we always clear chakras, and we're doing that energetically above the body. We're especially looking at anything that you have brought in. So we want your intention, like what is your intention for healing, and but we're also, sometimes we'll find things that you forgot to mention or didn't know. So because we're using our right brain and our expanded knowing, we can kind of tap into things that we wouldn't be able to do, let's say in the office when we're trying to say, okay, let's do these lab tests, let's figure this out. Sometimes we can do all of that, and if something else is there that we didn't think of, we may be able to kind of diagnose that from that expanded state. So we may find some things like that. Like I said, we work on the hologram, so we always reinforce a hologram and then put that template in place. We pull virus if that's an issue. Chakras, the auric fields, we reinforce levels, really usually out to at least 52. We're reinforcing those energy levels, and that also gives us information as we go down through the levels. Is that what you were looking for? Okay.
Where is your office?
Couldn't.
Where is your office?
It's in St. Charles.
And we do have some cards over here with the address that you can certainly pick up on the way out.
Have we reached the point yet where insurance is covering energy healing?
Slightly. I mean, we had somebody come out and try to figure out how we could code it and everything. That was some years ago, though. Mm-hmm. But today's insurance, are you kidding? It's like they don't even pay for medical things, really. I mean, it's just really, we're in a mess. So not really. The only way that we have gotten it paid for if you have an HSA or a flex spending or something like that. So we do, and a lot of the things we do at our office are not covered. They're more cash, but because it's in that medical setting, because I have a medical license and I do take some insurance, we can get the HSA to pay. So yes.
How many sessions does it usually take, and does it ever not work?
Oh, those are great questions. So So what I suggest, if someone's having like anxiety or something, or you know, something more simple, or they have like a really bad cold or something like that, I just suggest try this and see where it gets you. So most people will come out of an energy healing in one session feeling a shift and feeling like this is more how I'm supposed to run my energy, and how long you're able to hold that before old patterns come back in sort of determines. But if we're working with someone with a serious disease, so we're working with someone with cancer, autoimmune, you know, MS, some of those things, we're going to usually have them on a schedule. And so maybe once every 3 or 4 weeks we're working with them. Because the work lasts a while. And like I said, some of these other shifts make a big difference, but we can speed that up. Like whatever, when they have that shift about the meaning, or they're saying no to the fear, or they're shifting like that, things can go very quickly. So it really just depends. As far as it not working, I've never seen that. Because, I mean, I have had people who have, I do remember there's this one person who really, she had a really good healing and things shifted, but she kind of went out and sabotaged it, so she didn't feel like it worked because she just wasn't quite ready to be in that new place. So I did see that one time. But it always, you know, it always works. It may not, there's sometimes that something uncomfortable will happen, will pop out. And hopefully we can handle that within that session, but sometimes you know, it's releasing something, and you'll have some follow-on. So that happens, but it's actually part of the process. So it's not like, we're not like waving a magic wand so to make it disappear. So sometimes there's like reintegration. You know, you have to bring your emotions on board. That young self, where we're stuck, which is, you know, always part of it. That's where, you know, there's always some kind of link there. That part has to still, often needs some more attention. And, you know, kind of bringing that part on, it's like the mind, bringing it onto your lap, onto the lap of the higher self. So that can take some time. Even when we actually do the session, we warn people to be really kind to themselves for about 72 hours, because the work that we're doing to really anchor in takes about 72 hours. So the other great thing about that is you can start feeling better and better and better over this. It's like you get more, you feel pretty good afterwards, but you feel even better and better. So.
Have you ever reversed like osteoarthritis to avoid hip replacements?
I don't know that I have, or any of my people have been presented with that, but that sounds wonderful. We do osteoporosis, yes, and we do run, you know, energetic calcium, and we do things like that, so it'll be fun to try.
You had the example of the woman who, after she was suddenly widowed,
Yes.
she became ill, and then you worked with her, and then she became well, and then a friend of hers, that happened to her friend, and then she regressed back.
Right.
And my question is, could some of that have been a past life trauma that she experienced at another time? And do you think you were working in that field to help her with that? Would you have known?
I mean, the only way to know that would be from her. So I don't know. I think certainly it was like a similar hit. She was so close to that I think her physical self kind of like had this recurrence. I mean, she also got better from that. But
I mean, was the issue possibly her past life?
right, that's what I'm saying.
Yeah.
It's possible, but usually if that comes up, the person has awareness of it. Because when we're opening the field, we're opening it to all of those things, and they would say, or the healer, we would be there with that too. I mean, know that it's like, you see a scenario, and then after the healing, the person's telling you this. Oh, here's who I was. Here's what happened. So, if it's true, it's only helpful if they know that, and if it comes to consciousness.
Then that would be another part of the question is do you have conversation after the session with the individual? Now, what did you experience? And then so that you felt this or you saw that, and that person confirms it, or vice versa?
Absolutely, yes. And it's so fun because it's like, oh, I had that. Yes, I had that too. Even across the ocean, then it's really like amazing, so.
Thank you. I was just curious, have you noticed with the Me Too movement a lot more women clearing out a lot of things from like the first, second, third chakra?
I haven't seen, we haven't seen people coming in with that, but I would think so. I mean, I haven't had anybody coming in, but absolutely, that makes perfect sense. Just haven't had the opportunity. But I think that's beautiful. And there's other. You're giving me an idea, because we sometimes a group of us healers will get together and do something for the world, or so when Katrina hit. Whenever that was a while back, because I was in this advanced healing school, and we sat one day and went down to help. And it was amazing because we just opened up, went down there, did stuff energetically, and one of the guys he didn't know what he was doing or why, but he opened up some kind of waterway so that there wasn't as much of an issue anymore, and it was in the news the next day that opened up, and we were like, it was just. So you're giving me the idea that couldn't we sit, even a group of women healers, and put that out there, because it's like there's a need. And there's a really, it's like hard to think about that, but there's a need for that for the men too. There's something off, but doesn't it just go with all of the kind of the off nature of so many things? I mean, when we have an orientation that has really nothing to do with our well-being, but it has to do with making money, and that until you do that, you can't really be until you do all this stuff and get everything set and put your kids through school, and and then that becomes what you worship, as a culture we do. And it's like, okay, maybe when you retire you can be, or maybe so we're off. We're really off, at least on all those on the outside front. So I just think our best defense is to get right inside. So.
There's a question from someone watching online. Do you generally receive cooperation from traditional medicine when treating patients?
Well, when I was at Northwest Community Hospital, I had a group of colleagues that respected me quite a bit. And they were just, because I did all the normal stuff too. And I'm kind of not challenging about it. I'm not like on a soapbox, unless sometimes I am, but. So I worked together really well with them. And basically they just loved the results. I think surgeons are more open because they know that they can do the same surgery on somebody and not really predict who's going to heal better than the other. And so if there's anything you can do to improve those odds, it doesn't have to do with their skill. It has to do with whatever's going on with the person. So I feel like they're more like grounded in a sense. The internal medicine people are a little more skeptical because they have to figure it all out in their heads, right? So, but my friends were super supportive, and so we went in the operating room and did healings, and so I can remember just this one conversation where it was kind of teasing back and forth, but he was all about it. It's like, I don't know, whatever you're doing, just keep doing it. We had I had a patient that needed a hip replacement, and she decided to, and so she did healings before, and then intra-op she had a healing, and she got up and walked the next day, and she healed. Everybody was astounded at what she was doing, and so she sent her sister, same doctor, same healer, and so then he finally came to me and goes, okay, I don't know what you're doing, but let's keep doing this because I like what it is. So that's kind of the relationship that I have. I'm going to also say that I feel like that positions me really well to actually bring this to physicians, because I don't think I'm very threatening. I might not right away talk about past lives, the grids, this and that, but some of the truths where they can resonate. I mean, they're people too. I actually saw myself the other day just standing before the FDA and appealing to them as people. Because, anyway, I just sort of saw that. I don't know if I'll do it, but it was kind of a cool meditation.
Can you help someone with mental illness or drug addiction?
Yes. We have, in fact, so in terms of mental illness, we have people, our biggest two diagnoses are anxiety and depression, and we've had one healing reversal of anxiety for some people. I mean, often it takes a little more than that. And people that are on triple meds and that kind of thing, just moving off, getting their lives back. OCD. That's a special thing we do there, to look for it there. It's just like an energetic influence. And drug addiction is totally possible. It's a hard one though, because the person has to get themselves there to do the healing. And it's a little trickier, but not impossible. So.
Have you ever been able to help anyone with chronic tinnitus?
Yes. In fact, there is a technique, I can't remember it right now, that's just a physical technique you can do, but yes. Yes.
Well, whoever wrote in that question will know where to go for the treatment. Another question over here.
Could you tell us more about your online course, please?
Okay, well, I just had this idea. Well, I've been working with some people that bring things online, so they encouraged me to pilot a course. So what I did, we're going to do some of the basics of it in the Saturday, but what I did was I designed these 5 modules. So we got online as a group, and I did some teaching, and it was started with getting that vitality up, and then working with the mind. There were assignments every week, so it's a once-a-week thing. And just sort of delivered the material and gave practices, and just really watched people change. The other thing that I gave along with it was an intuitive session. I ended up doing 2 30-minute intuitive sessions. So the first one that I did, the first sessions, actually the very first one I did, I got given this technique of bringing them back to a time when that would be important for what they needed to know or were working on right now. And it was, I'm like, I don't know why I'm doing this, but I did, and it was huge. And sort of brought something to light that was an impasse, and so that worked, and so I ended up, just by listening, doing that with the next person and the next person. So then I ended up doing 2 sessions. I did one of those toward the beginning of our kind of class time, and then I did one toward the end. And to a person, it was moving what they uncovered. So so I was just trusting what I was getting to do, and trusting them, and that was a great part of it. So and we sort of went through the things. It was like, started out like really feeling that vitality and things you can do to do that, and then we worked really with the mind. So once you have this presence, you can kind of listen to what the habitual things are and work on it. But that other deeper part helped. And that was nice because they were doing it with me. Because a lot of times when I'm in the office doing an intuitive thing, they are telling me, but I'm also getting this other intuitive information and feeding it back to them, and they're saying yes. But this was them discovering it for themselves, and me just holding that healing space. So,
I'm just interested, with you being an OB-GYN, have you assisted people who want children to help them?
Oh, that is so great, yes. So we do energy healing, and sometimes they will get in touch with the soul coming in, which is just like the sweetest. I had a personal experience like that. I had my first child, and then I had 2 miscarriages, and then I had an ectopic in Mexico, and my husband at the time operated on me because he was, my partner at the office, and so anyway, so that was kind of cool, but because they gave me an epidural, so I was awake. I mean, in the States, they'd never. I was like, it was really kind of a cool experience. Anyway, but at the time of that, I got in touch. It's like I knew that I kind of got in touch with the soul trying to come in. I knew it was the same one. I hadn't lost anybody, and I said, we were just communing, and I said, you know what? I just don't have a house for you yet, but it's going to come, and then it did. So anyway, but that's one of the lovely things. Or people will get in touch with their loved ones who've gone on, too. So once we're out of the boundaries of the physical body and the mind.
Well, I think we're done with questions then. Maybe a hand of appreciation. Thank you so much, Dr. Mitchell.
Thank you. I'll be here, and if you'd like to be on my email list, I'll send you information about what I'm doing. I would love your support that way. So, okay.
Thank you. Yes, the sign-up sheet is on the table over there, as well as some cards and for you to take. As Dr. Mitchell mentioned, she will be teaching a workshop on Saturday. That it will be at between 1 and 3 p.m. Starts at 1 p.m. And the workshop is on accessing inner vitality, practical ways to use energy for health and contentment. And it is a practical workshop. You'll actually be learning some of these techniques that she has spoken about this evening. If you are interested in participating, I encourage you to go to our website and just scroll down under programs, look for workshops, and go to it and register online. That enables us to have a better idea of the number of people coming on Saturday. So I encourage you very much to do that. Thursday next week, we have Mina Lyle speaking on the Dharma-Karma Nexus. That's a pretty snazzy title, Dharma-Karma Nexus. Mina is he's on the board of directors for the TSA, the Theosophical Society of America, And he's been the director of one of the camps on Orcas Island, which I visited last year. Very beautiful, a really beautiful place. So he's coming here for board meetings, and he will be giving the talk next week. And so it's focusing on the nature of karma and how we can understand it and use it. And he will also be teaching a workshop on the Saturday next week, cultivating a virtuous life. So you may want to keep that one in mind as well. Thank you all so much for coming this evening. Thank you, Dr. Mitchell. I invite you all to stay for some refreshments and conversation. And I look forward to seeing you soon again.